Minister Hajdu, thank you so much for joining us today. You announced changes to Jordan's Principle. Can you clarify what those changes are?
Yeah, well, I mean, first of all, Jordan's Principle is a really important service delivery mechanism for First Nations children, and it's really about supporting equal access to a wide range of health and social and educational products and services. Each child might have a unique situation, and of course, this program has grown in leaps and bounds since the Government of Canada began to support First Nations with Jordan's Principle funding dollars and services. However, because of that growth, many communities have noticed that the backlog or the number of cases in the queue for decision has grown along with the program. And of course, we have to continue to protect Jordan's Principle, protect its long-term sustainability. So today I announced some changes that will help decision makers streamline decisions around Jordan's Principle, help providers ensure they provide the right information so that those decisions can be made quickly, and really start to create some parameters around some of the larger group requests that we're seeing coming in for provinces and territories in a way that has really, in some ways, disadvantaged communities.
Minister, we've heard of urgent applications to Jordan's Principle for things like modeling headshots and recreational items like a zipline kit. Is this why changes are being made?
Listen, I can't speak to individual requests because each request, is very specifically attached to a child. But what I can tell you is that what we have seen is because of the volume of requests and because of the fact that so many of those requests are urgent in nature, actually do relate directly to the health of that child, in some cases very specific health requests, that we have to have a better process to streamline requests and to make sure that the information with each request is really clearly identified to, first of all, determine, in some cases, who the child is, and secondly, to determine how that child not having access to that services is in any way delaying or harming their outcomes from a health or a social perspective. So these new guidelines will make it a lot easier for providers, for families to apply for Jordan's Principle, and they will also help weed out some of the extra requests that in many cases have not been provided with the kinds of detail that decision makers need in order to approve those requests.
And Minister, are you briefly able to explain what are some of the things that won't be covered anymore?
Well, one easy one to explain is big, large group requests from provinces and territories for education supports within off-reserve school systems. So we have seen an increase in provinces and territories applying for public servants, essentially, to staff public education systems where children of First Nations descent are attending. And these children are urban children. They may not be at all related to or living on a First Nation. And the detail around which children are being served is clearly not encapsulated in those requests. We believe at the federal government that every child does deserve equity and access to education supports and to health supports to ensure the best success for that child. But we also believe that provinces and territories have a responsibility within their own jurisdiction to provide equity in education. So that's a good example of the types of requests that won't be considered. Provinces and territories have been notified of that in writing.
Do you think these changes will help speed things up, and will they fall in line with the orders from the Canadian Human Rights Tribunal?
We believe this will help speed things up. In fact, many of the changes will ensure that providers need to provide some very essential and I would say basic information. For example, we've received invoices from providers that don't contain complete information about the treatment date, about children's names, and about the kinds of treatment that children have received. That really does delay the decision making by the decision maker on those group requests. And now there will be clear guidelines for applicants about what kinds of referrals are necessary for different kinds of supports or services, what kind of information needs to be contained within those requests so that decision makers can make those decisions more quickly. There's less back and forth from providers to the Government of Canada, and the queue can move more quickly. This is really about efficiency of service and really the integrity of the program. We want people to continue, including non-Indigenous Canadians, to have confidence in Jordan's principle that it's meeting its goal of addressing fundamental equity for First Nations children. And that means we need to ensure the integrity of the program through a process that people can understand.
Minister, we'll have to leave it there. Thank you so much for your time.
Thank you very much, Beeson.